Let's talk a moment about some reversible causes of dementia. Now, we've been talking about dementia and we refer to Alzheimer's disease being 60% of all dementia. But there's a little mnemonic that I learned along the way that went along the word dementia. Again, dementia is the big umbrella. That's everybody that has some cognitive impairment in their memory. But then a segment under that will be 65%. That's the Alzheimer's patient. Let's talk about some reversible causes of dementia. If we use the mnemonic, meaning D being the first one, then that will be drugs. What drugs can also affect a person in a negative way that might make them appear that they have dementia? Well, there are many in that category. And if your mother, father, brother, sister, husband, if they're on lots of medications and they're coming down with some memory changes, these are some of the things you want to discuss with your healthcare provider. Next in that mnemonic will be E. What are some emotional things? Depression. Depression can look just like dementia, but there's a difference. When a person has depression, they can usually come up with the information even though they may not want to, because apathy is a big part of depression. So for example, say you ask a person what they had for breakfast, and a person that's depressed, they say, well, I don't know what I had. I had something. I just had, and they're down, and they're talking that way. Or a person with dementia, they may say, I don't know what I had. They're not going to be able to come up with it. Where the person with depression, if you push them, they could come up with what they had for breakfast. And this is why apathy in the depressed person sometimes can look like dementia. Something you also need to look out for. Next in that mnemonic would be M, metabolic problems. What might that be? B12 deficiency. There might be some thyroid problems. A lot of women have some hormonal issues. Those could end up being a metabolic problem, which could be associated with Alzheimer's disease as well. What's another one? Ear, hearing. If you have hearing impairment and you're not hearing well, a person could think that maybe because you're not hearing well, you're not understanding, and that could be something to look into. What will be next part of the mnemonic? N. Normal pressure hydrocephalus. That's an issue that happens within the brain where the pressure expands in the brain too much, and that can cause a picture that looks like dementia. What's another category? T, tumor. Is there a tumor mass somewhere in the brain that could be causing this? In this United States and throughout the world, cancer is a big deal. And sometimes cancer starts in the lung, the prostate, the bone, starts in many different places of the body, but it could also end up in the brain. It could start in the brain or it could travel to the brain. And if it were to do that, travel to the brain, then they could begin to have some mental decline. They could begin to have some confusion that could look like Alzheimer's disease. Another part of that mnemonic, again, we took the word dementia and we're going through the letters of dementia as possible reversible causes of Alzheimer's disease. Next one would be infection. If a person has an infection for whatever reason, they can have what we call an increased SED rate, and that increased SED rate could lead to some challenges and could lead to some decrease in their mental and cognitive functioning. And the last one would be anemia. Now there's others, but these are just ones that we're talking about. Anemia, if a person is anemic, they also may have challenges with their memory, and the memory may also not be just as sharp as you want it to be.